Hello to my soon-to-be graduating Mercy College radiologic technologists. I'm very excited for you. I know that the times right now are very uncertain as far as kind of what's ahead and how kind of the duration of the program experience even is going to be working. But I know that, at some point there is going to be an end to that, and really in that end, there's going to be a beautiful beginning. And so what that is you entering the field and in the profession formally. And so I'm very, very excited for you to be at this point. And really, honestly, you've accomplished or just about have accomplished the goal. That goal at hand to become a healthcare provider, to serve others. And so I'm just really excited for you and happy, I guess, for you to kind of to be at this point in your career and just about ready to take those next steps. And I know that within those same thoughts, I'm sad that we don't have more concrete answers for you at this point as far as what those specific next steps are gonna look like for you, and there's uncertainty on test dates and different types of things. But I am proud of you and excited for you, for all that you've accomplished during the program. So at this point, I want to kind of get you thinking about, what your future career looks like. And so for some of you, that may mean additional education, and for some of you, that may mean job relocation and different types of things for yourself. But regardless of kind of that scenario for yourself and what that really means, it's just important to think about you yourself as a radiologic technologist and saying, what do I want the rest of my career to look like? Or what do I want my immediate next steps to look like? Think back to, kind of some of those alternate modality experiences that you had, and was there any of those that you thought, wow, this could be a place for me. Like this is where I want to go. And start to really ask yourself those questions, start to really reflect, and because I think within some of the next steps or some of the options that we have within the program is that we can help secure some of those next steps. So we can help you get clinical placements in those modalities of interest. And so that can hop steps, and you kind of put your future in your own hands a little bit there, instead of waiting to be cross trained. Perhaps it's that we can facilitate some of those experiences on your behalf throughout some of our options. And so just starting to think about those, I think, is important. And so I wanted to at least present to you about some of the options that you have for medical imaging and within imaging cert programs as well, and just so you can have that kind of that deeper understanding of what we can provide you as Mercy College students. Additionally, what's nice is that there is a alumni discount that applies to the medical imaging program, so that will be something to think about. So that's a pretty nice, sizable discount for alums. And then additionally, the other thing to think about as you make plans to continue your education is then once you secure a job and thinking about that process is to try to better understand what their tuition reimbursement process really looks like. And so that's a great question for a job interview, if you're interested in your bachelor's degree, because then you could get perhaps some funding for somebody to either pay for it completely or offset some of those costs. So really great mechanism for you to think about there as well. So wanted to introduce some of my team members, and I know some of you have taken some of the IMG courses so far as part of the certificate initiatives. So some of you have had some of these instructors previously, but just to do a little bit of introductions, I teach majority of our quality and safety content. So what that really looks like is I teach our quality improvement course. I teach our research course, and then I also teach our capstone course. But then wanted to introduce some of our other team members that you may not know. So Dr. Amy Lee teaches our MRI courses. Brittany Dockery, who some of you may have engaged with in the clinical facilities. She teaches our sectional anatomy course. Is also a CT technologist and soon to be mammographer. Gina Arnold teaches our women's health imaging courses, so mammography or breast imaging courses. Darcy Carasso teaches our CT courses. She teaches our imaging informatics course and our DEXA course. Rachel Davis teaches our vascular interventional course, and then Jordan Hermiller currently teaches our communication and patient ed course. But he's another kind of flexible resource. He's a medical imaging manager within the kind of the Central Ohio area, and so he just brings a different type of skill set and different knowledge base to some of his course assignments and what he does in the program as well. This isn't my full team. One member of the team that you already know is Dana. So Dana does teach a little bit for us as well. So she teaches us some of our safety and standards components. So some of you may be working with her in that particular course as well. So, but yeah, just wanted to introduce some of the teams so you better had a better sense and an understanding of kind of who's on that team. As far as options for yourself kind of going forward, the bachelor's program, so BSMI is what we typically call it, Bachelor's of Science in Medical Imaging. It builds upon your framework as RAD professionals. And so what we really look at, and we already obviously have all of your transcripts, so that process is pretty seamless to be able to get into any of these programs, is that you just really, I would apply online and select your program of interest and then kind of go from there. But the BSMI program really just kind of builds that framework. It has all of these cert programs kind of integrated in them. So if you ever wanted to, pursue CT, you can pursue that through the BSMI program. Same thing with mammography, you can pursue that through the BSMI program. We do have our imaging cert programs as well. So those are things to think about if one of those modalities after you were exposed to it, you're like, oh yeah, that's really what I want to do. So we do have that for CT, MRI, and mammography as well as DEXA scanning falls into the women's health imaging component as well. And so some defined start dates. So women's health imaging or the mammo components do start in August. So you'd want to apply now if you do had an interest in there. But these they're 12 credit hour fully online programs that do not have a clinical component. So the assumption here is that you're getting your clinical component through on-the-job training. We do offer a clinical component through the BSMI program. So that would be something else to think about. And so we can facilitate some of those arrangements. And each clinical experience does differ. I always encourage persons going straight from an associate degree to a bachelor's to explore that clinical option because it allows you to quickly integrate into that next modality or that modality of interest or of most interest to yourself. So things to think about there. And we can facilitate all kinds of different things. And it's not just in the Mercy system. We have different agreements across the state of Michigan, across the state of Ohio, that we can kind of forge and open up, and so we can do all kinds of different things. We have the most agreements in the state of Ohio, so we're really kind of scattered throughout the state. So, and are really working on. Greater opening up Central Ohio, so the Columbus area as well. So we do have all kinds of different options that are out there for you to pursue a clinical. So as far as the presentation goes, majority of my talk is really going to center on the bachelor's program. So we've talked about the CERT programs before, and I also have a presentation on the CERTs program within the resource centers. So if you have any questions about those, certainly reach out and let me know. But as far as the medical imaging program, this is really a foundation, builds on your existing foundation. But what's nice is that within the program, we allow persons of all different imaging science disciplines to kind of come in. And so yourselves obviously are radiologic technology grads, but we also allow primary pathway radiation therapists, nuclear medicine technologists, MRI technologists, and sonographers to come into the program. So kind of a really cool way of kind of diversifying the members within the program itself, as far as like who's in the respective cohorts. But essentially, you name the imaging modality, we're going to have somebody in the program that has that. And so it's not just persons that go straight from an associate degree to a bachelor's degree, so not just recent graduates, but we have persons kind of all over the spectrum, including all over the nation. So we have students in 27 different states. And so you really kind of get that glimpse of what's really going on in medical imaging nationally, but then persons are in kind of all different experience levels as well. So really great opportunity to really learn from your peers that way. Um, Within a bachelor's program, what I always want you to think about and continue to ask yourself is will you be ready for the future? Or on the flip side, what does the future look like for you? And so how are we going to carve out plans and set that foundation for you to be able to achieve some of those goals? And so those are some of the things that I really want you to think about because the bachelor's degree can really open up some significant doors for you. And so that can take you from current environment or current opportunities, so that can change, kind of your job location, or it can help change your job shift, or it can help change and shift some of your job responsibilities. But then it also can position you for things like the advanced imaging modalities. We have a focus on entry level management, and so preparing you for those future opportunities. What's nice about our medical imaging program, since Mercy College is regionally accredited, is that it also allows you to prepare for graduate school. And so if you wanted to get your MED and start teaching in the classroom, you can work towards those types of things and utilize this bachelor's degree then as a springboard for graduate level education. And so a lot of things to think about, but the bachelor's degree does open up substantial doors, and it's not just those areas. So we have a focus on informatics within the program. Bachelor's degree will open up opportunities for different vendors, and so that could be vendor applications, it could be vendor sales, it could be pharmaceutical sales, different types of things. The bachelor's degree can, kind of open up some of those doors for you. And so those are some things definitely to think about, and think about what's kind of ahead for yourself as a mechanism for really setting yourself apart from each other. So at this point, you are each other's competition. You are going to be vying for similar jobs. And so one mechanism for separation is to say, I'm working on my bachelor's, or I'm working on this advanced imaging certificate program, and you want to contribute in this particular way. And so that doesn't mean that it's all about additional education. It doesn't mean that at all. In fact, at this point, I really want you to think about what makes yourself different. And so in terms of job readiness, thinking about those soft skills that really make a difference. One of the most important soft skills right now is being a team player. Quite honestly, is your ability to work hand in hand with others, and that doesn't mean necessarily just your patient care skills. That's a huge important component, but also from a team environment component or a team culture and component, is that you really need to be able to work together. And so think about those soft skills that make you different, and think about ways for you to continue to leverage those for yourself as well. So definitely, opportunities, I think are out there and are available to you. And so what I always tell individuals is that Mercy College's BSMI program cannot support all of your career interests. As an example, even my own pathway, I went from radiography to radiation therapy, and so we don't offer radiation therapy. So there are different makeups and different programs that are out there that may help you achieve your goals in different ways, and I'm more than happy to have those conversations with you. I want to have those conversations with you. So it's not just for me about getting you into our medical imaging program, but it's to help to foster that lifelong learning or love for learning, for what could be ahead for yourself. I can tell you from my own personal experience is that because I've continued my education is really how I've been able to kind of navigate to the areas that I've really wanted to. And so it's important to kind of continue to develop yourself to be able to kind of position yourself in those ways. But I would love to have conversations with each of you about kind of what those opportunities may look like for yourself. And I'm more than happy to point you towards different programs that offer things that are different than what we offer. I do think Mercy College's program, because of our healthcare focus, because of our integration in Bon Secours Mercy Health, does make us a little bit different. And what also makes us different is when you start to look at different medical imaging programs or that market themselves as completion programs, is when you get into the curriculum itself. Some programs fill out the rest of your degree with general education courses, which helps you makes you a well-rounded professional, but may not necessarily help you get to where you want to go. From a field perspective. So within our medical imaging program, what makes us, I think, different is that we do have a core focus on imaging content, imaging related content, as well as that administrative feel to our program as well. So kind of nice and well rounded that way. As far as who will be in your courses, I mentioned this, kind of across the nation, persons from different modalities, persons with different levels of experience. But we have persons that work in education already. We have persons that are department administrators within the program. So persons are definitely at all different points of their career, and I think based on our design is that we really speak to helping persons reach their goals where based on where they're currently at. And so I think persons utilize the curriculum and the content and the electives differently because of those ideas. So it's very important to me to make sure that our curriculum is relevant, it's timely, it's trending. And that, so because of that, I'm always doing different types of tweaks to be able to manipulate our content to be able to make sure that it's meeting some of those demands. So that's very important to us. It's also very important that, as far as our program goes, is that I don't pigeonhole you into one particular area. And what I mean by that is that you may get into something, say, as in the administrative content, and then you get into those positions, you're like, no, this isn't what I wanted to do at all. And so what we do is we take a very balanced approach. That way you kind of understand kind of the spectrum of opportunities out there. And so we do that by focusing on three key areas. So advanced imaging is one of those. 15 credit hours of advanced imaging is required. We also look at healthcare management, when specifically this is really kind of tied into two ideas of medical imaging management. And so we have a medical imaging management specific course as part of the program, but what we're trying to do is prepare you for entry level opportunities. And so we also have a minor available in healthcare administration, and because of how our major is built with this focus area already in it, is that you can achieve the minor with just 2 additional courses. So really great opportunity there to kind of further say, okay, I want to go into the management side of things, but what's best and why I always recommend this program for radiologic technology students is that, instead of in as opposed to kind of a general healthcare management type of perspective, is because when you take a quality course, we take quality from a medical imaging perspective. When you take the safety course, we take safety from a medical imaging perspective. We have the medical imaging content. We have imaging informatics instead of healthcare informatics. So you're really kind of further delving into different components within medical imaging that will make you better managers, as a result. So things to think about there. We also have our technical component of our program, which really is probably my favorite component. It's the one that I largely teach it within, but it really kind of focuses on principles of quality, safety, patient-centeredness, and then our informatics and research courses are also within there. So each of these components are really kind of 15 credit hours. They're all kind of embedded within the program. So the core major itself is a 45 credit hour major. And so if some of you have taken any of the imaging cert courses, those are going to transfer in course for course, or come in kind of course for course. So you've already completed components of your degree requirements. So many of you have completed this course, as an example, IMG 400. So that's one course less that you would have to take to be able to get your bachelor's degree. And others have taken, so things like sectional anatomy would fall into our advanced imaging electives. So those things are kind of out of the way at this point, and so furthering your ability to kind of proceed through this in a timely manner. So all of these courses, again, are offered in a fully online format, so you don't have to come to campus at any point. You can move anywhere in the nation that you want to move. So there's that, and still kind of meeting and lending towards some of your career and professional goals that way. We do have general education requirements, that are specific to the medical imaging program. So there may be some additional gen ed that you have to get under your belt. And so one example of that, so I know you have med ethics completed, or you're in process of completion, but there are 6 total credit hours of REL coursework that's required. So a religious studies elective may be necessary depending on your background and what comes in. And so one thing to kind of note is that our student records, the department, only brings in coursework that's relevant to your current program. And so what that means is that they have only brought in general education courses from your previous academic history that were relevant to the RAD program. So when you apply to the bachelor's program, what they do is they relook at your transcripts. And so they'll relook and say, okay, well, we thought you thought you only had this many credits, but really for the bachelor's program, this many credits transfer in. So it's a different way of looking at it, and the likelihood is that, especially if you've been in college for a little bit of time, is that you've probably fulfilled a lot of your general education coursework. So things to think about there. What's nice is that these advanced imaging electives here, 15 credit hours, they're really it's student driven. So this is where you kind of fall in and say, okay, here's how those imaging certs really work. And so you can see the courses tied to the CT cert. You can see the courses tied to the women's health imaging cert. You can see those that are relevant to the MRI cert. So kind of within these elective options, and as I mentioned before, everything is fully online with the exception of this option for IMG 431, which is practicum. It's considered a very variable credit hour course. We approach practicum very different in the bachelor's degree than we do the associate degree because we are built for working professionals. So we try to be as flexible as we can. You can enroll in as many hours as you're comfortable in enrolling in. We do have recommendations, but we work through the process. It's all repetition based, so we try to time it out so you're not doing more time in the clinical setting than you need. So once you complete your reps, you've completed the process, that type of thing. So it's really great opportunity to kind of build that skill set, flexing around your future work schedules and those types of things. So really a little bit different than what you're currently used to there. Also, that's just a general example of what a typical 15-hour workload looks like. And so this is what we call our CTMR option. So, you can see how those types of things are built. Something to think about ahead is licensure. And so once you pass your certification exam to maintain that licensure, the ART requires 24 credits per biennium. And biennium is just like every 2 years, and it corresponds with your birth date. And so what that really means is, and why that's relevant. Obviously, it's important. But continuing your education in a formal manner through Mercy College, because we're regionally accredited, allows for each academic credit to be equivalent to 16 CEs. And so what that means is that just by completing a single course, you'll complete your biennium requirements. And so, a single 3 credit hour course would be 48 CEs, so doubling up your biennium. Unfortunately, those do not carry over. Like, it's not like a lifetime worth of credits. It's just, credits per year biennium. But definitely things to think about, and another advantage of formally continuing your education is it's a really easy way to meet your continuing education requirements. Additionally, this is something more future oriented to start to think about, is that what's nice about the imaging program is that we have multiple ways of approaching things. And so we can either help you get a clinical experience, and become CT certified through our IMG 431 options, or later in life, and say you've gained the cross training, you've already become certified as a CT technologist, and you want to continue your education then beyond that, is that we do waive courses for advanced imaging credentials. And so once you secure a CT, or once you secure an M, or once you secure any given credential, really, is that we start to waive out coursework for what that would look like. And so that includes really pretty much all credentials associated with ART, as well as credentials associated with other relevant credentialing organizations, imaging credentialing organizations as well. So there's that, to start to think about, and how that really works. So basically, we say that when you become certified in these areas, is that you've achieved the associated course objectives, which are for certification. So we can either use these courses to prep you for the exam, or once you're certified in those exams, then the flip side is that we waive out courses. So different ways of approaching that, but just a general table of some things that are relevant, how they correspond. We do have a lot more robust options even than this, but they're not all going to be relevant to you, because some of them tie to sonography organizations, nuclear medicine organizations, etc. So, but we do that as an option. What's also nice about the medical imaging program is that we're intended to be flexible. And so for those of you that may not have taken a course within the medical imaging program, is that all of the courses are offered in the accelerated format. And so what that really means is that they're either 8-week courses in the fall or spring, or 6-week courses in the summer. And so a full-time plan of study would really look like 2 courses the first 8 weeks and 2 courses the second 8 weeks. And on the flip side of that, a lot of my students, especially with those working and may have family obligations and responsibilities there, do proceed part-time. And so what that looks like is a course at a time. So 1 course the first 8 weeks, 1 course the second 8 weeks. Of course, it takes longer, to do those types of things, as far as, part-time versus full-time, but nonetheless, you're still kind of chipping away and actively making progress towards your degree, and it will get done over time with that particular progress. So thinking about those types of things, we can also be very creative, and so you say, okay, well, I don't have that much going on right now. let's go full time, and then when you do start to have more going on, we can drop you down to a part time, or vice versa. If you're like, oh, there's too much going on, I'm not sure, what this is going to look like, you can start part time, and once you get comfortable with it, you can jump up to full time, and we can do like any combination in between. So if you wanted 15 hours, we can do that. If you wanted 9 hours, we can do that. So we can be very creative as far as what that would look like. In terms of kind of a real life schedule, this is a true example of what it could look like for you, particularly if you haven't taken any of the. I would say that this is typical. So if you've only taken what was required in RAD, it's very typical that your plan of study would look very similar to this. So a full-time plan of study would take 5 semesters. However, if you've taken the advanced imaging certs, or any of the general education coursework or anything like that, it's going to shave off considerable time for yourself. So I've had persons that have gone in that pathway, that really kind of complete out their bachelor's degree in 2 additional semesters. So it just kind of depends. It's different for everyone. It just all depends on what you've completed, what you haven't completed. But I would say it's very typical to be able to see this 5 semester layout. Part-time plan of study, same amount of courses that you saw before, just a course at a time. You see, it takes longer there, but in this case, you're completing out in 3 full years. What's nice about the program also is that we start each semester, so it's not that you have to start in the fall, or you have to start in the summer, or anything like that. But we do have kind of this rolling admission cycle for this particular program, so you can kind of flex that out based on what your needs are at this time. The other thing to note is that we do require licensure for this program, so ART licensure, to be able to continue in this program, but it's not required until the start of your second semester within the program. And so for some of you that may be, kind of in limbo, you can always get started with the medical imaging program here in the summer or in August. Start to take some of those courses and get those out of the way as you're waiting to take your licensure exams as well. So that won't be a problem. So hopefully that this has been informative to you. I know that this is long. It's a lot of information, but hopefully good information. And just really appreciate your time and all of your energy. And I just really look forward to kind of your future successes. And, at the college, lifelong learning is so important. And, I admire our graduates. I think they do a good job, whether that's formally or informally, kind of continuing to stay relevant within the field. And, it's our field is dynamic. It's constantly changing. And over the course of your career, what medical imaging looks like right now is not how it'll look in the next 10 years. It will look differently. And so continuing your education and continuing to prepare yourself for kind of what's ahead and carving out some of your own unique opportunities, I think is very, very important. So feel free to always reach out to me at any point. I'm always happy to kind of help answer your questions. Drop me an email. We can schedule a time to be able to chat candidly about what some of those options will be, and I'm happy to give you honest and real feedback about different types of options that may be available. So best of luck over the next the coming months. Be safe out there, and just know that I'm very, very proud of you for nearing the end of completion of your associate degree. Congrats.